Hello, this is Lindsay Schmad, and here is the Word document of the summary of changes according to that first Excel spreadsheet. So for each level, I've kind of discussed the simple changes here. So health disparities, determinants of health, this would move to a post-conference or some sort of online lecture or pre-read for community engagement day. Also with skin integrity, I think I did forget to put this on the grid, but you're already discussing skin integrity, consequences of mobility. So in 200, they did wound care. So just adding those little, making sure that that gets covered. I think it's already being done in 102, but just to clarify, just adding wounds to skills when you talk about pressure ulcers for skin integrity. For 200, again, the main content is the OB content being added. So in order for that to happen, health disparities, determinants of health, cultural respective care, cognitive disorders, that gets moved to or paired with a post-conference discussion, community day, and then perfusion, we added the PAD to be discussed with PVD, cognition, removing dementias because it's already taught in 102. OB content, again, 200 and 400 would have to discuss what exact chapters or pages from Loudermilk would fit with the normals for 200, and then the complications would be for 400. Again, there's some verbiage here that we discussed might need to change a little bit to clarify differences between 200 and 400. Nursing care of populations with anxieties disorders, we removed that from 102. Stress and anxiety, it's already taught in 102. Making sure genomics is moved to an online recorded lecture or clinical post-conference. For surgical client, just ensuring that drains are covered with skills or surgical client lecture day. And then families client and communities client getting moved to recorded lecture and tied into agency analysis projects and discussion. So I made this little checklist to hopefully help faculty recognize, like as they're preparing content, just ensuring that these things are getting taken care of. For 300, health disparities would move to a clinical day. Concept of perfusion, adding acute renal disease, acute kidney injury, or just ensuring that it's getting taught. Cognitive disorders, tying Down syndrome into the Down Syndrome Alliance clinical experience, and then also some of the others into clinical post-conferences and discussions. And then for ACE, it would be new content added to 200, and then traditional would not change until fall of 2025. And then mood disorders would be for 300. I think I missed that. So, and removing it from spring of 400. So hopefully this is a little bit clearer to see, depending on whether you like looking at a grid or a checklist. I hope this isn't overwhelming to anyone. That was not our intent. Our goal was to be able to move some of this OB content from 400 to level it across and then create space in 200 for that to happen. So hopefully this helps. I believe Meg and Chris will send this out for curriculum team to review and provide a date to vote. So don't be afraid to send me an email or message if you have questions. Thank you.